Thank you very much, Minister, and good morning. So I'd like to start by backing up what Minister Foley has just said about people doing the right thing and helping us to combat this virus. All of us, every member of the Victorian community, following these lockdown restrictions is really important. Close contacts staying in isolation throughout their infectious period is also critically important. We've seen today that when a case was notified, they immediately travelled back home from regional Victoria into isolation as required, and they only made that one stop for petrol, had limited contact with staff, and even disinfected the credit card that they were using before handing it over. These are the types of COVID-safe behaviours that limit the spread of the virus and that keep all of us safe, our families, our friends, and indeed the entire community. The interstate incursions of COVID-19 show that only when we are properly protected, the only way we can be properly protected is to be vaccinated when we're eligible. So there are some vaccine locations which are currently experiencing high demand and appointments are booked out. If your local vaccination centre is booked out, look for appointments in surrounding suburbs, as they may have better short-term availability. Critically, there are still appointments available in many centres for second doses of Pfizer vaccine and AstraZeneca vaccine. And we know that many second dose bookings are now due, including for those who received Pfizer vaccine in recent weeks. I really urge everyone to finish the job and go and get that second dose of vaccine, because we know from data overseas that, including for the Delta variant, that second dose of vaccine is so important at protecting against infection, but even more importantly, for both Pfizer and AstraZeneca vaccine, greater than 90% protection against severe illness or hospitalisation. So please do go and get your second dose. All healthcare workers, hotel quarantine and international border workers, and their household contacts aged 16 years of over for hotel quarantine and border workers, plus residential aged and disability care workers and residents now have priority access in Victoria for Pfizer vaccine. So we've prioritised 10,000 Pfizer appointments next week for these groups, and we still have plenty of capacity for AstraZeneca. But we know that not everybody in Victoria can easily get to a high volume vaccination centre or even to their local GP. People without secure home arrangements, people with limited access to transport, and generally having difficulties in accessing the latest health information. These are real struggles facing vulnerable members of the Victorian community. So our focus now is to remove remaining barriers that may prevent someone from being vaccinated. One of the ways we're doing that is by bringing pop-up vaccination sites directly to services operated by community health organisations. And this includes homelessness services, drop-in centres, crisis accommodation facilities and rooming houses. And we're starting in the Melbourne CBD, Collingwood and Footscray. Each of these vaccination teams will include 2 community health nurses, a social worker and a peer worker who has experienced homelessness, with clinics having the capacity to vaccinate 40 people a day. There'll be dozens more pop-up sites in the weeks ahead across Melbourne's inner north, inner west and in the CBD. The network is led by IPC Health in partnership with CoHealth, DPV Health, Each and Star Health, all being community health centres that have done such fantastic work supporting our community throughout the COVID pandemic. So Victoria, as a state, has been leading the country on vaccinations, and we really also want to be in the place of leading the way on taking vaccinations to those at greatest risk in our community.